Dear friends and colleagues, I'm very glad that I can talk to you here, at least online. Next year, I will be with you again in person on the next congresses in 26. I wish you a very interesting congress with lots of information and lots of impulses for your daily clinic. And we will start now with a very old, not very old, but old subject and brand new, which is the ER damage, ischemia reperfusion damage during surgery, especially heart and brain. So the protection of mitochondria, cells and organs from this ischemia reperfusion damage through preventive redox regulation by ozone. Why is it so important to protect the mitochondria? As everybody knows, they are the powerhouse of the cells and have essential functions and tasks especially of maintaining cellular metabolic balance. They have the task of the provision of energy in the biological form of ATP, which plays a central role, as well as the production of reactive oxygen species as defense mechanism. And there are protective antioxidants in order to maintain the redox balance. Here, the cell with the mitochondria inside, and here with the mitochondria and the different mechanisms. Now, we will focus to the oxidant and antioxidant status. Mitochondria are the main source of oxidative stress. So we have to look that oxidative stress is not getting too high inside the mitochondria. How does it come? If there is any deficit, we will not have enough electrons to be transferred to the oxygen we breathe. Oxygen is normally reduced to water. If we need here for that, we need 4 electrons for one molecule. If that is not available, it will stop with only 1 electron transfer, forming superoxide radicals. That is the beginning of oxidative stress. Now, basics. Starting a surgical procedure, the blood flow is interrupting for a while, and then it generates ischemia over normally 15 minutes or more. And finally, the reperfusion is started, whereby an excess of oxygen floods immediately in the ischemic areas, and they are not able now to metabolize. The overstrained mitochondria are not able to metabolize the oxygen immediately. So reactive oxygen, not enough electrons are transferred. Reactive oxygen compounds are formed, such as superoxide radicals, the first one, the beginning. Hydrogen peroxide, hydroxyl radicals, which are the worst ones. So we have to avoid too many of them, lipoperoxide, and so on and so on. So as a consequence, we find the destruction of several cells cells, and finally organs. There are lots of preclinical studies. Preventive ozone applications have achieved excellent results and open up a new concept of oxidative preconditioning with medical ozone according to the low-dose concept for optimal protection against ischemia reperfusion. I show you, I have took from the literature several examples, but only those where oxidative stress and antioxidant, so the redox balance, is measured. Ischemia reperfusion injury and its protection by ozone preconditioning. Here we measure repair parameter, SOD especially. I took especially lots of parameters had been measured, but I extracted SOD and glutathione. Repair parameters are antioxidants. They are here in green. And oxidative stress parameters are in orange. Here MDA, malondialdehyde, which is one of the most frequent parameter, thiobarbituric acid substances. It doesn't matter which it's an oxidative stress parameter, here the same. And here MDA, SOD, and so on. Now, glutathione, you see, I like to take glutathione because it's a very, very reliable parameter and expresses the situation. You see here, 1998 was the first publication in that subject, and this group around Olga Leon, they started with these things. ER, hepatic protection, liver disease in animals, and nephrotoxicity, also to prevent nephrotoxicity. Then there's a break of 12 years or then more, even 20. And we have a group, we have lots of Chinese groups with very high quality papers. And they took now this method, and I'm sure they have already started clinical studies. These are all preclinical. So you can see here, myocardial infarction, myocardial protection, ischemia reperfusion protection, myocardial protection, myocardial protection, cerebral protection, cerebral protection. That's what we focus to. And you see that always the same results. The protection parameters, antioxidants go up. Antioxidants go up. At the same time, oxidative stress goes down. Same here, same here. Antioxidants go up. Oxidative stress goes down. Same here. And here in the cerebral protection as well. Now we focus to myocard and to cerebral. But what is the mechanism of action? We know that the mitochondria are the organelles which produce oxidative stress. Superoxide radical, H2O2, and what happens? This is the normal healthy biological system. We get radicals, lots of other radicals. We get lipoperoxides. We get malondialdehyde, which we take as parameter for oxidative stress, and the consequence is high oxidative stress, inflammatory processes, pain, aging, age-related diseases, cardiovascular diseases, cancer, diabetes type 2, and so on and so on. Now we come with our ozone. We have high oxidative stress and give ozone. What does it mean? It's also a strong oxidant. Ozone itself will not penetrate the cell membrane. It has a polaric structure which does not allow it to pass the polaric cell membrane. Instead, it will react with unsaturated fatty acids, which we have in the cell membrane, with isolated double bonds. This is the quickest reaction, and then it will form ozone peroxide, which is not a correct chemical name. I call it here ozone peroxide, meaning peroxides which had been formed by ozone and fatty acids. Now this reaction, now this peroxide were reduced immediately again by glutathione, and this reaction gives the information to the nucleus via nuclear factors. Be careful, there is an oxidant. Please produce the antioxidants to keep the redox balance intact or to restore it. Our focus now is on myocardial and cerebral ER damage, which are the most common types worldwide that occurs after heart attack or apoplexy. Now, first to heart protection. Is there any possibility of mitochondrial biogenesis? Perfect regulatory processes take place between the cells and their mitochondria. If the cell has a high energy requirement, mitochondrial activity increases. The metabolic rate is intensified and ATP production improves. That is the interaction in a biological system. Now, protection in the heart muscle, coronary artery bypass. Surgery is frequently associated with IR damage, which can be significantly reduced by oxidative preconditioning using the NRF2 pathway. NRF2 itself must be kept in a balance. Not to initiate, must be kept low in low concentrations, not to initiate, e.g. metastasis. That means ozone concentrations and doses must follow the low ozone concept. Now, is it heart protection against ER damage through ozone-mediated mitochondrial biogenesis? Is that possible? To increase the mitochondrial effects? Moderate physical activity leads to optimal intercommunication and signal transmission. Mitochondria are increasingly stimulated to multiply, i.e. to divide. Can ozone preconditioning induce mitochondria to multiply? Can it induce biogenesis? Increase of mitochondrial densities? That's a question Barakat in Egypt, in Cairo, asked already 20 years ago. It was also published, but unfortunately in German, and nobody recognized it, or only a few people. So let's see what happens. Mitochondrial density following ozone preconditioning. This is in animals with a heart ischemia reperfusion and heart surgery, and the mitochondrial density had been measured in the control group. Nothing happened. Then ozone preconditioning, a low concentration, and after 2 months, the mitochondrial density increased. After 3 months, it drops a little bit down again. Well, this is for sure. Now, what happened? Oxidative stress has to be diminished, has to be reduced. And in the biological system, we know H2O2, hydrogen peroxide, I take it just as one example because everybody knows about it, is reduced by the glutathione system. This reaction gives the information to the nucleus. Be careful, there's oxidative oil stress at low ozone concentrations. Then the redox signaling is starting, regulation of physiological processes is starting. At high concentrations, it is blocked. At high concentrations with oxidative oil, we call it oxidative distress, the regulation is blocked. In the biological system, at high H2O2, as one example, if the oxidative stress is too high, let's say after 3 marathons per day, the regulation is blocked. And of course, the sports people will recognize the results, the clinical results. Now we come with our ozone. Ozone peroxide, you've seen that already. Low concentration is doing the same. Oxidative oil stress, regulation, that's what we want to have. Regulation, upregulation of antioxidants. And at too high concentrations, we get a blocked regulation. Now, what can we measure? What do we measure? As inflammatory stress proteins and protection markers. And what had been measured, what you have seen already in the diagram, oxidative stress markers. MDA is the most frequent parameter. And on the other side of the balance of protection markers, the antioxidants, mostly SOD is measured. But we here took glutathione, the reduced form of glutathione. We can also measure gamma GT, gamma glutamyl transferase, the liver enzyme, and also cytokines, interleukins, the interleukin 1, 6, TNF alpha as inflammatory cytokines. That's what we don't show here. Now, glutathione is one of the most important intracellular antioxidants with a TO group SH as active center, as lots of biological enzymes. The balance glutathione reduced at active form to inactive form has to be maintained in order to control the redox status. So this balance is normally far on the side of the reactive glutathione, the reduced form, so that it is really able in each cell to protect the cell from antioxidants. Especially in liver and red blood cells, we find 90% of the reduced form and only 10% of the oxidized form. And this has to be, the old balance has to be rebuilt again. A glutathione GSH deficiency has lots of diseases as a consequence, chronic inflammatory diseases, cancer, especially age-related, aging processes, age-related diseases. That means in diseases which are associated with chronic oxidative stress. And all these, as you know, are ozone indications. Now we come to the next, protection against brain ischemia reperfusion injury after apoplex maybe. And here we have normally a lot of neuronal cell death. Can we protect it? And this is done in a cell model first to find the correct concentrations, because of course we know ozone also can destroy cells. And here it is done, the cell activity of neuronal cells in percentage, independence on the time when they are contaminated with ozone in different concentrations, as usual 20, and you see 20 is the best. The cell activity is the highest. With 40 it decreases, and with 80 it decreases again. So it is what we ever have seen. Be careful with the concentrations. Don't take the high concentrations if you don't know what really happens. So this concentration of 20 was taken, and we look at the specific and special parameters. Here the oxidative stress parameters, what happens with them after, this is an animal model, not cell, animal model, and glutathione as the antioxidant capacity, as we take it as antioxidant capacity. Now, against brain, so they had all these animals had been operated, sham operated, so no surgery, then surgery after ER damage, and pre-treatment with ozone. So this is here, the blue one is the operation group. This is operating group with ozone in prevention, and the same with MDA as oxidative stress. And you see oxidative stress in sham operated is small, going up after surgery, and down in the group which got ozone in prevention. The contrary with glutathione, the antioxidant, antioxidants in the sham-operated group is high, in the operated group is diminished, is decreased, and increases after ozone preconditioning. So same results as we have seen already in the first diagram. And what is very important, of course, for the patient is a clinical result. And we find a tremendous reduction of the infarct volume. And the number of neurons are kept high. And look at the infarct volume in percentage. Sham operated, no infarct volume. Then after surgery, ER damage, infarct volume increases tremendously, and are low after preconditioning with ozone. So if you have the possibility to treat your patients before operation, before surgery, it is very helpful. And now the number of neurons, did we protect them as well? Here, the sham operation, number of neurons, no decrease, but after surgery, a tremendous decrease. And after protection, so after ozone preconditioning and operation, it's up again. So I think it's a very interesting. We know that from patients for a long time, but we never had some measurements. Okay, who is not so familiar with the procedure, I just explain it very shortly. We have for systemic ozone treatments, we use two methods. This so-called major autohemotherapy, 50 to 100 ml of blood, are enriched with 50 to 100 ml of ozone, low concentration, and then re-infused as a normal infusion. Or rectal insufflation, same concentration, is given via a catheter, and here the dosage ball, which contains 150 ml. So we give normally two of them, so 300 milliliters of ozone, concentration low, the same. Now, taking everything together, very shortly, systemically administered ozone with its mild oxidative stress acts as biological redox regulator in cases of chronic oxidative stress and in prevention of oxidative stress. It upregulates the enzymatic antioxidants and restores the glutathione balance. Immunomodulation, what we have not shown here, it downregulates the pro-inflammatory cytokines. One good parameter is interleukin 6. You can see immediately how it decreases, and upregulates gamma interferon. Thus, ozone is an ideal complement in primary and secondary prevention, such as age-related diseases, chronic inflammatory processes, rheumatoid arthritis. So I thank you very much for your attendance and for listening. I just give you some future perspectives, which is really interesting. Ischemia reperfusion damage remains a major problem in surgery, primarily based on high oxidative stress generated during the reperfusion process. Ozone oxidative preconditioning, low dose, provides a new concept to restore the redox balance, to protect the mitochondria and maintain cell integrity. Basics are well known, guidelines have been published, and here the knowledge here presented in myocard and brain ischemia reperfusion models could be transferred directly to clinical studies. I wish you very good success in your clinics, and maybe you can integrate it before you send the patients to surgery. Thank you very much and see you soon.